Time now for Morning Rounds with CBS News contributors Dr. Holly Phillips and Dr. Tara Narula. First up, new concerns about controlling the spread of the Zika virus in the U.S. Florida Governor Rick Scott declared a health emergency in his state over cases of the mosquito-borne disease. The announcement comes on the heels of a confirmed transmission of the virus in the U.S. Texas health officials say it likely happened through sexual contact, not a mosquito bite. Tara, how common is this type of transmission?
It's not very common, Anthony.
Yeah.
It's what everybody's really afraid of. But before this case in Dallas, there were two case reports. One in 2008 of a Colorado scientist returning from Senegal who reportedly infected his wife, and another in 2014 of a Tahitian man who had Zika symptoms, then had a blood test several weeks later that was negative, but his semen and urine tested positive. So, this is definitely a route of transmission, but experts really tell us that the primary road or highway for transmission is the mosquito, not sexual contact. We're not expecting this to lead to widespread and rapid transmission of the virus. It does highlight the need for us to do more research to really understand how this virus works, how long it could persist in semen. And so there are still a lot of unanswered questions around it. One of the other issues that's come up is whether this could be transmitted via blood transfusion. And so the Red Cross has taken steps as well this past week to say that anybody returning from a country with Zika should self-defer donating blood for about 28 days. And if they do donate and then develop symptoms 14 days later, they need to call the Red Cross and let them know.
What we keep hearing, though, is no symptoms, no treatment, no vaccine. I've been curious in watching all the coverage. Is it just pregnant women who should be concerned?
Right. Certainly our focus and all of our discussion and energy really is around concern for pregnant women and women who are trying to become pregnant. We know the Zika virus can cause microcephaly, which is a birth defect that still has lasting effects throughout the life of the child, and that's a very serious concern. But to put it in perspective, for the general population, even if people were to contract Zika, most people don't get symptoms. 80% of the population doesn't get symptoms. For the 20% who do and are not pregnant, the symptoms are relatively mild. You might get some fever, some body aches, conjunctivitis, which is a redness of the eyes. Now, there has been a link with a more serious symptom called Guillain-Barré. That's a condition that can cause paralysis, but it's not clear how common that is or how directly connected with the virus it is. So the concern is less about the general population, but a very serious concern for pregnant women.
So, Tara, what do you do to protect yourself from this?
Right. So the recommendations now are that pregnant women or those considering getting pregnant avoid travel to areas with the virus. Also, that if you do have to go, that you use repellents, stay in screened-in areas with air conditioning, avoid being around areas that have standing water, or get rid of standing water, and basically use long-sleeve clothes or pants that may have been treated with permethrin to avoid the mosquitoes. In addition, in terms of the sexual transmission question, the CDC is planning to update recommendations about that. But for now, they have said that pregnant women should really avoid intercourse or make sure that they have intercourse with a condom with any male partner who may have returned from an area that has a lot of Zika transmission right now.
Well, next up this morning, a new poll finds many Americans are working to limit their sugar intake. The poll, conducted last month, found 58% try to eat less sugar over the past 30 days. That is higher than the percentage of Americans trying to cut calories, sodium, or carbs. Do you like this? Do you like the idea of going back on sugar?
Absolutely. Yay. Right? Right. So I think this is a reflection of basically a war on sugar, an outcry from the medical community, the health community, nutrition, wellness. So many entities around health have said there's very little, if any, benefit to sugar, and added sugar is our enemy. It contributes to the obesity epidemic, heart disease, tooth decay, very few redeeming qualities. One of the things that I really found compelling about the study was that it showed many more Americans are now aware of hidden sugars. Yeah. These are sugars, anything, if you look at an ingredients label and it ends in ose, so we're thinking fructose, maltose, dextrose, high fructose corn syrup.
Are the sugar substitutes in this camp also of the oses?
Yeah, they can be, but mostly we're looking at items that you don't even think of as sweet. Things like pasta sauce or salad dressing, that sort of thing, where you might not think this is a sugary substance, but it actually is. So people are much more aware of that, and they're avoiding the sugars.
So what are some of the keys, Tara, if you're looking to cut down your sugar intake?
Yes, because these added sugars can be sneaky and hide in a lot of our foods and drinks. So one of the things you can do is basically know what tends to have added sugars. And those things would be desserts, candies, sodas, energy and sports drinks, and a lot of the fruit juices that are out there. And if you want to be a detective, you basically look at your nutrition or ingredients label under the total carbohydrates section, and it will list total sugars by grams. The problem is that sugars includes both natural sugars and the added sugars. The FDA is now proposing that they add to the labels something called percent daily value of added sugars, which would make it easier for people to really tease out how much added sugar's in there.
Right.
But as Holly said, the easiest way for now is to look at the ingredient list, look for the OS words, fructose, glucose, and also other things like honey or maple syrup or cane juice or cane syrup, those other ingredients that would be code for added sugars.
And Tara, that's a very good point. I think by changing the label so that it represents what percent of your daily calories are in those added sugars, I think that would help everyone. The new USDA dietary guidelines said less than 10% of our daily calories should be of added sugars. So if it's right there on the label, I think that'll make it so much easier for everybody.
All right, finally, if mornings aren't your thing, your DNA might be to blame. A study by the genetics service 23andMe looked at data from more than 89,000 customers. The company uncovered 15 DNA locations associated with being a morning person, including 4 genetic variants that have never been connected to sleep cycles. We have an excuse. We always have an
I'm
excuse
waiting
now.
for them to change the DNA, because being a morning person, it is not fun living with 2 non-morning people. Yes.
It's not their fault. It's in their DNA.
I know.
Dr. Holly Phillips, Dr. Tara Narula, thank you both so much.